Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 119,451 confirmed cases of COVID-19 in Canada and 40,046 cases in Ontario. Chatham-Kent has 317 cases, and Sarnia-Lambton has reported 326 cases. Michigan now has 87,403 cases, with 12,966 cases being in Detroit. Today, we are reporting 2,379 cases of COVID-19 in our community, an increase of 11 cases from yesterday. 5 people work in the agri-farm sector, 4 are in the community, and 2 are still being investigated. 173 of our cases are currently active and are being followed by our health unit. 2,135 cases have now resolved. 155 people are self-isolating and 8 people are in hospital. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 1 retirement home is experiencing a COVID outbreak. In addition, there are currently 11 workplace outbreaks. 6 are in the agriculture sector, 4 are in the manufacturing sector, and 1 is at a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. First of all, I want to congratulate the residents of Windsor and Essex County for moving to Stage 3 of the provincial reopening. The move to Stage 3 is an affirmation of the great work that the community has done in following public health measures. The move to Stage 3 will definitely alleviate some of the economic, mental, and social well-being of our residents, but it is now even more important for all of us to follow the public health measures. We've been following these measures since the beginning of this pandemic, and we'll have to continue to follow all these measures. Physical distancing will continue to be the key to prevent any transmission. Face covering will add another extra layer of protection to the physical distancing measures, and most importantly, stay home if you're sick and get tested for COVID. Your public health department will continue to support the entire community, business establishments, municipality, health system partners to manage this pandemic as we continue to progress through this regional reopenings. Your public health unit staff will be more actively monitoring the data trends and the impact in our community, and as a result of Stage 3 reopening. Recently, the provincial government, in consultation with the Associate Chief Medical Officer of Health, added measures for restaurants, bars, and other food or drink establishments to limit the spread of COVID-19. These new measures apply to establishments whether the region is in Stage 2 or in stage 3. These measures include: all patrons are required to be seated at all times in both indoor and outdoor areas, with limited exceptions. Bars and restaurants, as well as tour boat operators, must keep a log of clients and our patrons for a period of 30 days. These logs must be made available to the Medical Officer of Health or Public Health Inspector upon request. These additional measures will help reduce the potential spread of COVID and support the V2 in case and contact tracing should an exposure to a linked that is linked to a restaurant or a bar or any tour boats. Restaurant servers are required to wear a face mask while working. Face masks should be long enough to cover your mouth and nose and should be snug but not too tight. As well as under the local Section 22 order, patrons are also required to wear a face covering when inside a restaurant. Masks are not required to be worn when sitting outdoors on a patio, drinking and eating. We continue to receive and follow up on complaints for restaurants and bars, in particular complaints related to inappropriate use of masks and lack of physical distancing on patios. Both business owners and patrons have a role in ensuring that everyone is protected from COVID-19. To get your question answered or to file a complaint related to bars and restaurants, please call our Environmental Health Department at 519-258-2146 extension 4475 or visit www.wechu.org. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Windsor Star.
Yes, good morning, Doctor. What are some things that residents really need to keep in mind as we move into stage 3?
So the public health measures will be the most important measure. And as we are moving from stage 2 to stage 3, again, it's just a reminder that the virus is not gone outside of this community. The virus still exists in our community. We have active cases in our community. And the best way, the only way we can move forward is to make sure that we are following all those measures. So despite move to stage 3, physical distancing, face mask, face covering are the most important measures that we can do. And most importantly, if you're sick, staying home and limiting your number of close contacts to as low as possible.
Thank you.
Any questions from CTV?
I haven't really looked at the whole list yet, but I'm just curious, like, out of all the things that you're permitting, are you the one that made the decision on permitting all of this, kind of like the CK officer did, or was this kind of brought down by the province saying this is what you have to do?
So the guidance documents are from the province, what is allowed in stage 2, what is allowed in stage 3, and some of the restrictions that is set up by the province in terms of the numbers, in terms of the business, the activities. So all of those are set by the province. Of course, under the Health Promotion and Protection Act and looking at our local scenarios, there may be additional measures that we can put, additional restrictions. But right now, we haven't made any changes to what the province is proposing right now. But we will be actively monitoring all the data, actively looking at all the issues that are impacting our community, and if needed, we'll make recommendations accordingly. But as of now, all the guidance that is in the provincial document, we'll just continue to follow that.
Also, sorry, I didn't get to say hi to you. Sorry, Dr. Ahmed. Also, just hospital capacity as well. Did that factor into the decision in letting us move into phase 3?
Definitely, a number of rationales and reasons and indicators are looked at when making such decisions. The case count, the case rates, the trend, it's one indicator. Hospital health system capacity, public health unit capacity is another consideration or indicator that is looked at. And also some of the factors that goes beyond just the numbers in terms of where these cases are and are they contained, what's the system capacity to address those issues, what are some of the control measures that are in place to manage that, and if more cases occur in those areas, what would be an impact in the community? So all those consideration goes into all these decision-making process.
So right now, it's to my understanding that the hospitals are near capacity. Are you of a different opinion, or is that true?
Well, we did present our data. The hospitals are roughly around at 85% capacity, and this is something that we are obviously closely monitoring, as well as the hospital partners are also monitoring. We have to recognize that many of these hospitals are now open for elective surgeries, elective procedures as well. And if needed, the hospital will have plans to scale back to what they're doing right now. But those conversations will happen if it gets to the point of really pressed for resources. But as of Friday, when we presented our data, based on our data, the hospitals were operating at 85% of the capacity, and that has been a threshold that was established, and we'll closely monitoring that number as well. Okay,
and one more, if I may, real quick here. I received a note saying that some trustees are not okay with the back-to-school plan, and I guess residents are being encouraged to send the health unit a message. So I'm just curious, have you received any calls on that issue?
Well, we received a number of calls on this issue, and as always, we the community and our residents' safety and well-being is of our top priority. We obviously want to balance everything, and we recognize the importance of in-person education for younger children. So we are aware of that, and then we are also looking at what these plans mean and what kind of risk that it would pose to the children. So we are working closely with the school boards to review their plan, provide our feedback, and also working with our colleagues across the province to have a more of a consistent approach and recommendation that would be that will keep our children safe and also provide the education that they need in this time.
So if need be, would you intervene, or would you kind of just, allow, like you say, the uniformity of the province to take over?
Well, we obviously are more concerned about our region in particular, and what we like to see definitely is something that that is more broad and not just restricted to Windsor-Essex, but if need be, if this is something that is backed by our local data, our local challenges, anything that is needed locally will happen locally.
Okay, great. Thank you, sir.
Any questions from Windsor-Right?
Good morning, Dr. Ahmed. With Stage 3, we're allowed to do various activities such as dine in restaurants, bars, gyms, fitness center, personal care services, performing arts, that sort of stuff. Given that we sort of have a 3-week head start on the other regions, are there any particular activities that you've seen that are more risky or that you're concerned about with us moving to Stage 3?
Well, not only from locally, but I think even from internationally, the data is always suggestive of high risks in indoor settings, especially in bars. And people need to be mindful of all those restrictions and challenges, recognizing that often when people have a few additional drinks, they may not be in a position to follow the appropriate physical distancing and follow the public health guidance. So it is even more important that now you have access to it. How can we do it more responsibly and safely? So that's why it is there. And again, we will be looking at the data. We'll be looking at those numbers. And we want to work with the bars and restaurants, with the operators, as well as with the residents. We want to make sure that we are creating an environment that is safe and that is not contributing to a spread of COVID-19, and we need everyone's support on it. So hopefully with all this learning that has happened throughout the region with these tight spaces, indoor spaces, that's something that we'll be keeping a close eye on. And some of the other local data that we have seen, especially from Ottawa, with respect to these indoor parties and young adults, young children are coming together. That's also something that we'll have to keep reminding our residents that this is also an important place. Moving to stage 3 doesn't mean that the virus is gone. Virus still exists in our community, and it takes only few people to spread it among many people right now, because throughout this pandemic, the number of contacts, the number of activities were limited. So even if someone who's sick is outside, is able to infect few people and not a lot. But in stage 3, if a sick person and is not taking appropriate precautions and others are not taking appropriate precaution, the likelihood of them spreading it to many people is significantly increased and can cause significant problems for our communities. So please be mindful that moving to stage 3 does not mean that the virus is gone. We have to follow all those measures that we are following right now and will continue to follow until at the point when we see that the virus activity has gone down or completely gone from our community. Until that time, please follow all the public health measures.
The City of Toronto, when moving to stage 3, they had some additional measures that were implemented, such as ensuring that no more than 10 people are seated at each table. Has the House considered any additional restrictions moving into stage 3 for Windsor-Essex?
So we haven't put any restrictions at this place, but we obviously are looking at all the options, and we want to make sure that, you know, if this is an issue locally here in terms of what this means and what are some of the complaints that we are getting. So we'll try to be on top of it, and then we can add more restrictions to it. But right now we haven't put forward any specific restrictions on any of the activities at this stage.
Okay, thank you.
Any questions from CBC?
None at this time. Thank you.
Any questions from AM 800?
Dr. Ahmed, when it comes to stage 3, how will this impact you and your team in the enforcement? Because obviously they have to go to more facilities now. You got fitness centers, movie theaters, the casino, if the casino opens. How will this impact your team?
It will definitely impact our team. We're already getting lots of complaints, and our team is trying to stay on top of the following up on those complaints, as well as doing some proactive work. We definitely require more support from our municipal partners, our bylaws, our police. We all need to work together to make sure that, you know, we're trying to go after which makes more sense for each of us. So we will be working closely with them, and it just requires more collaborative approach and, more importantly, support from our residents. We definitely don't want to do more enforcement. We want people to follow those recommendations, and that has been our approach, more education rather than enforcement. So hoping that our residents will support us, our residents will follow all those recommendations, and we'll continue to enjoy everything that we want to enjoy, even as the province continues to open more and more.
When it comes to the education aspect of it, with stage 3 now, I believe the inside is 50 people, outside is 100 people. And then obviously you got the movie theaters, the casinos, different establishments like that. Will there be an education period for stage 3 similar to stage 2?
Well, we want that mostly, again, when we're talking about education, we're not talking about if someone is not following anything at all. I think what we are trying to do, education, is more on if there is maybe lack of clarity, lack of understanding, and then that's where we are doing most of the education. If there's a complete lack of respect for what the restrictions are, it can be a fine right to begin with. It doesn't need any education. But I think the education piece is what we want to support is, a lot of these regulations, a lot of these requirements can be confusing. And people may not necessarily know that how they will enforce it or implement it at the facility. So our approach is to support them implement it, and rather than penalizing them right from the beginning. But if there's any blatant disregard of any restrictions, it can be a violation right from the beginning. So I think it's when we're talking about education, we're not saying that we're not doing it. So hopefully some of these guidance that is already available, we'll try to share it more broadly in terms of what it means and what it doesn't mean with stage 3. And the businesses, the residents, everyone should be aware of what those restrictions means and how they need to follow those restrictions.
Thank you.
Any questions from Radio Canada?
Yes, thank you. I'd like to know if we move to stage 3, does it mean that you consider or we can consider that the outbreak in agricultural industries are under control?
Well, I think that's the ones that we are dealing with. Obviously, we can say that once we start identifying cases, appropriate control measures are in place. And no one can predict what happens and which farms or which workplace can go in outbreaks. So the only way to prevent that is through proactive measures that we've been working for some time. And right now, the farms that we are dealing with, obviously the outbreak is under control in those farms. But there are obviously new farms, new cases that continues to come. And our team and the health system partners, we all work together to manage and contain it. So far that's been going well with the additional support that we've received from the province through EMAT, through Ontario Health, through Red Cross. So all of those partners are working together to support the agri-farm sector. And based on that, we can say that it's fairly managed and controlled at this time.
Okay, thank you. And can we consider also that the next step would be the opening of the border?
Well, that's something that we obviously are more concerned about, and we'd like to see much stronger measures to ensure the safety and well-being, especially for our residents in Windsor-Essex, recognizing that we are one of the largest land crossing border with the U.S., and it definitely posed many new challenges for us. Even at this time, as a lot of people from Windsor-Essex go to Michigan and work there. So hopefully, we have a good, strong system in place when the border is more broadly open.
Okay, and I know that you're not in charge of that, but do you know how many farms have been tested so far?
So I think in total, 38 farms have been tested based on our last number that we have seen.
Thank you very much.
Any further questions from Windsor Star?
Yes, I'm just wondering, has the health unit released its recommendations for school boards on its website?
The toolkit.
It's still in draft.
It's still in its draft. Sorry, Taylor. We'll try to. We were doing some edits, and we'll just post it as soon as it's available. We'll send a note to you. I apologize. I know you've been waiting for it.
No problem. I appreciate it. Thank you. I'll look forward to the email when it does come.
Thank you.
Any further questions from CTV?
Yeah, Dr. Ahmed, it's been quite the journey just to get to this stage, even throughout the whole 6 months. So just curious, how do you feel heading into stage 3?
I feel much relieved that we have come across a long way, and the more comfort I will get is if we can see no further increase in the cases as we are opening more. So I think we'd like to see that the community continues to follow all these measures, and we continue to support our residents. And as a region, we move past not only the health crisis that we were dealing with, but now dealing with more of the economic and social well-being of our residents.
Awesome. Thank you. Have a good day.
Thank you. Any further questions from Windsorite?
No, thank you.
ABC?
No, thank you.
AM 800?
No, thanks.
Radio Canada?
No, thank you.
Okay, thank you, everyone. Thank you.